Bukedea District Health Officer Dr. Ikodet has attributed a rise in malaria cases in the district to lack of mosquito nets. Dr. Ikodet says government gave out a one-off mosquito nets 3 years ago and they are now worn out.
A few challenges we had here were referrals, which the Right Honorable Speaker sent us a new ambulance. And of course, but the burden of disease is still a problem, like malaria is coming up, it's a burden. Government gave out mosquitoes some 3 years ago, and normally after 3 years, these nets degenerate and people go back to square one. So one of the biggest burdens of disease in the district has been malaria, diarrheal diseases.
He says that over 70% of the current diagnosis in the district shows that malaria is the leading cause of death in the district. This was during a 3-day health camp organized by the Speaker of Parliament Anita Annett Among.
The most emphasis I would want the camps to put emphasis is the non-communicable disease, things like diabetes, things like high blood pressure, among others, because they are hidden. Most of these people don't carry out those tests. People fall sick, they only get facilities when they are in different stages of screening. We are also going to have interest in screening cervical cancer. Most of the facilities don't do that. So you find that these people are left out, people are treated, the conditions are not curing, and then they have underlying factors. And of course, we're also going to extend to stretch to test for HIV as well.
The 3-day medical camp that is taking place in all the health facilities across the district is being undertaken by over 200 medical interns from the 10 medical schools across the country.
So as a federation, we feel like by us also engaging and coming to we are here today in Bukedea to provide free health services to the people of Bukedea. It's always key because most of the times the people are suffering and there's a lot of information, medical information, off-the-counter drug use. So by us being here, we are going to have sessions of health education, testing, examining our patients, and also giving them drugs. Those who are complicated, we will be referring them to the higher level units that are within, and also Malaria regional referral. So we are here to impact lives, to treat the people of Bukedea.
Bukedea residents stand up in big numbers and commended the health camp that they say has helped them to receive health care at no cost.
We have been suffering with the sickness, but the doctors were not enough, but we are happy to the Right Honorable Speaker of Parliament for what she has done to Bukedea District today.
Going to health centers, but the number is too much, so we could not get the treatment. We could not be tested, and even the machines could get spoiled sometimes, and we go for private and we don't have money. And we are happy today that we are getting free examinations, free treatment, everything free.
I used to come here because I'm the born of this place, and this is the place where I've been getting treatment from. And the service here has been poor because you come in the morning, you go late in the evening, like at around 6 p.m. But at least today, I'm also going back early.
Though Bukedea District has a population of over 300,000 people, it has no district hospital and only one health center for. Philip Aguta, UBC News in Bukedea.